Okay. Okay. Is it true? Yeah. It's true, no? Okay. So, my dear friends, now today we will be covering uh, worm infestations. And before we go in for worm infestations, and in these worm infestations, we'll be covering two major worm infestations. The rest of the ones, please, you can read up. One is ascariasis, and the second is hookworm infestation. And we will then be, after this, be considering as to what are the problems which occur with worm infestations and how national programs have been made which can circumvent these problems which are occurring in our country. Now, the first worm infestation we're looking at is ascariasis or roundworm infestation. It is an intestinal infection caused by parasitic roundworm, the Ascaris lubricoides. This is a very common infestation, especially in children, very common infestation in our country. And the reason for this is the poor sanitary facilities in our country. Everything rotates around health, everything of health rotates around hygiene and socioeconomic status. As we have seen, socioeconomic status and hygiene have a large part to play in a large number of diseases. And in our country, with the poor sanitary conditions which are there in our country, we have a lot of ascariasis. Most common helminthic infestation, and it's said that about 1.4 or 2 billion at the present moment, the counts they say is 2 billion people are infected. And if you look at the say about 2-3 decades ago, also we had 250 million people infected, but this is going on rising. As the population rises, as the sanitation becomes worse, we will land up with more and more problems. Severe ascariasis infections cause about 60,000 deaths per year. So it is not that it is a disease which does not cause any deaths. Deaths are known in ascariasis, and this is because of the load of infestation which takes place, plus due to the complications which can occur. And most of these deaths which are there are in children. So if you start looking at the distribution of ascariasis around the world, you again find it to be present wherever the socioeconomic status is poor and wherever sanitation is poor. You look at Asia, which is what 73% of ascariasis cases. Also, I mean, there's another thing to be looked at. If you really look at two big nations, two most populous nations of the world, the most populous nation of the world is China. The second most populous nation in the world is India. India is now running neck to neck with China. We should be overtaking them in a year or two. So 1.5 billion and 1.3 billion. This is the population. So 2.8 billion population is there in just these two countries. And the rest of Asia also, if you include it, you find that this is the place where sanitation is very poor, where socioeconomic status is poor. Also in Africa, the same story, sanitation poor, socioeconomic status poor. And in the Americas, when you start looking at, North America is prosperous, Canada, etc., the places is prosperous. But South America is a place where you have poverty, socioeconomic status is not so great. So you're aware of these things. I really don't need to go into detail because you've studied this in detail when you were doing your microbiology pathology classes. You had the agent is Ascariasis lumbricoides. The male is, unlike humans, the males are shorter than the females, 15 to 30 centimeters, where the females are about 20 to 35 centimeters. It's the largest nematode which we have, and the reservoir of infection is man and only man. The infective material is feces containing the fertilized eggs. Now, please remember, in this particular case, you have infective material as some material which you have eaten, which is infected by feces, which have got the fertilized eggs. So it has to be from insanitary conditions. I'm just keeping on repeating this word, insanitary condition, insanitary condition. So this is what you should also remember, that this is due to insanitary condition. The Ascaris egg are more likely to survive and develop more rapidly in shady, moist, clay soil. Again, in sanitary conditions, if the person goes for open air defecation and also is involved in farming where you use the same soil where the open air defecation has taken place, that is the way in which possibly a large number of infections take place. Also, children playing in these fields, playing in areas where open defecation occurs, where the growth of where you have these eggs which are surviving, these can cause the infection. A single female lays about 2 lakh eggs a day, so huge amount of eggs which are there. And so life cycle is well known. You're aware of this life cycle. You have the worm, and if you start off with the worm giving the eggs and the soil from the soil, there's the different stages of the egg formation, and then it is ingested at the larva formation, and the larva, then once it forms, is in the intestine, can migrate to the lungs, and this migration can cause various complications. So let's see what are those. As far as age is concerned, the infection rates are higher in children, mainly because that they do not maintain enough sanitation. There is no predilection for the male or female sex, and malnutrition is a predisposing factor in this disease. This again, let me again try and emphasize what I've been doing in various times in my various lectures. Malnutrition. What does malnutrition lead to? Why malnutrition will lead to hyperproteinemia? What are immunoglobulins? Immunoglobulins are proteins. So any patient with malnutrition will have decreased amount of immunoglobulins. If he has decreased amount of immunoglobulins, he is prone for all diseases. This is a very simple problem. And once he is prone to more diseases, he suffers from further malnutrition. It's a vicious cycle. So Ascaris is a geohelminth. And as I mentioned, that it is open air defecation which results in this problem. The eggs remain viable for several months, and in shady clay and soil which is there where open defecation has taken place, and temperatures 25 to 35 degrees. In our country, almost throughout the year. In South India, in North India, yes, you have certain winter months where you don't have the temperatures of 25 degrees, but most of the year we have these temperatures. So that's the reason the growth of the helminth is no problem, and we do have this present all over our country. So ingestion of food or water which is contaminated with the eggs is the route by which it is which we have the infection taking place. Also remember that once you cook the food, this will get killed. But eating uncooked food, eating salads, now a large amount of times you find that you get salads from the market, and these salads, remember, we are using in number of fields, we are using sewage water for cultivation. Sewage water which is there, which is used for cultivation, can result in these eggs being deposited in various vegetables. These vegetables, if you do not wash them prior to eating, especially salads are eaten raw, and if these are not washed well before they are eaten, you can land up with these as well as various other problems. Also, those people who are working in the field or children who get contaminate their fingers with the soil, they can, if they don't wash their hands properly. A proper washing of hands has been demonstrated to you a number of times. Now, especially in the COVID times, washing of hands is very important. Minimum amount of time to be spent is 20 seconds. Minimum amount of time. You must wash the front of the hands, the back of the hands, the web spaces, the wrists, the nails. All these things require to be washed well. Scrub the web space of the thumb. All these require to be done well. And this is something which you, as a doctor, once you become a doctor, must ensure that you train all your patients in. This can cut down a huge amount of infection in our country. Two things which can cut down a huge amount of infection in our country. One is hand washing, and second is this mask. The mask which is there will cut down a huge amount of respiratory infections in our country. We have our country suffers from a large amount of tuberculosis. If we had universal masking, we would have cut down on tuberculosis infections to a large extent. That's for a different day. Okay, so we have, you're aware of the pathogenicity and the problems. The adult forms can result in nutritional problems. You can have some toxic effects and mechanical problems. We'll talk about it in due course of time. And the larval forms, once it migrates, you migrates to lung. You have got allergic. You can have allergic reactions, cellular reactions, or infiltration of leukocytes. You can have bronchitis. You can have various other problems. So, what are the signs and symptoms of ascariasis? One is the simple passing of worms in stool. Worms which can, once they keep on migrating or the worm itself migrates, it can come out. People have seen worms coming out to the nose or mouth. They can be when the larva migrates, there may be a low-grade fever, cough when you have this migration, it takes place to the lung. You have got cough, bloody sputum, wheezing, shortness of breath. All these things can take place due to the allergy as well as due to the migration which is taking place. Wheezing, shortness of breath, skin rash, and stomach pain. But note, a large number of times, or most of the times, children with ascariasis have no symptoms whatsoever. So that is the most common, 80% of the time, there are no symptoms whatsoever. So as we put it down into this particular chart, pulmonary distress is cough, wheezing, dyspnea, hemoptysis, and a pneumonitis you can call it a Loeffler's pneumonitis. Intestinal, you have got colicky pains, intestinal obstruction. When the load is very, very high, intestinal obstruction can take place. Abdominal tenderness. If it goes into the biliary tract, you've got biliary colic. Blockages can result in gallstones or obstructive jaundice. So what do you do when you wanted to have a diagnosis? You take a proper history of any case. You have to take a proper history. What I've seen is students, once they pass out, they generally tend to write their case sheets like as if they are consultants. Write 2 lines and that's all, almost writing the diagnosis. Please continue to follow what we teach in the college. Write a complete history. Once you write a complete history, especially, and you write, even in that, you write what are the various no's. No fever, no cough, no this. If you write all that, then you're excluding a large number of diagnoses. Many a time you'll miss out diagnosis. Okay. Stool examination, demonstration of eggs, You have to demonstrate eggs in the stool, and uh, the egg count is done. Egg count, we'll talk about egg counts later. So egg counts can be either in the stools, or it can be in water, or in sewage. This thing, we can do a lot of egg counts which are there. Sputum examination, you can demonstrate the larva. Very rare, very difficult demonstration of larva and sputum. And there are what is called the Charcot laden crystals, which I must have been taught to you in microbiology. Not my job to teach you all that. Lab studies, basically eosinophilia, and imaging. In a chest X-ray, you may get features of increased bronchial lines which are there. Also, you may get some patches, and you may in some cases endoscopy is done, not really required. Malnutrition, you can do various tests for malnutrition if you want to do it. This is in a normal case. What you require to do is only and only a stool examination. So what do you do as far as care is concerned? Care is concerned, basically we're talking about now more about complications. The normal this thing, you just give the treatment for the worm, which we'll talk about last. Pulmonary disease, you need treatment is basically symptomatic. Patient is wheezing, he's got a constriction, use bronchodilators. You may have to use some steroids if necessary if there's marked airway inflammation. And give antihelminthic 1 to 2 weeks after treatment with the bronchodilators. First you do the bronchodilation, and then you can do the antihelminthic treatment. Intestinal obstruction, if it takes place, you can think of antihelminthic therapy, and on the basis of colicky, abdominal pain, antihelminthics, we'll talk about this. See, this is intestinal obstruction which took place, in which you had huge amount of worms which obstructed. Nowadays this does not take place. These were things which used to take place when we did our M.B.B.S. Nowadays we have people who are coming in with colicky pain are generally given by the quacks or by the physicians. They are given antihelminthic therapy quite early, and hence we do not get such states nowadays, very rare nowadays. So surgery for intestinal obstruction can be done, whether it is if there is a hepatobiliary obstruction or otherwise due to the load, we can do a surgery. Most people recover from the infection totally. There is no problem at all. Complications, you can have a biliary tract obstruction, or you can very rarely have a perforation. Blockage of the intestine, as we said, subacute intestinal obstruction or intestinal obstruction. Abscesses are very rare. Now in prevention, we will talk about basically what we are looking at is to ensure that personal hygiene, sanitation, health education, most important, and specific protection is basically you want to have sanitary disposal of feces, and you would like to give mass chemotherapy. We have a deworming, national deworming day, etc. We will talk about it at the end of this lecture. And so primarily level, we want to do a sanitary disposal of human excreta. A lot of work being done today on it. There are lots of toilets being built by the government. Funds are being given to the poor to build their toilets. Unfortunately, many a place you find that the toilet is built, but there is no water connection. There's a huge amount of problem in that. Water has to reach to the house, and then only you can have a proper human excreta disposal. You should have safe drinking water. Drinking water which should not, there should be no likelihood of contamination of this water by sewage. Good food hygiene habits, personal hygiene, and I keep repeating, health education. Health education is most important. You as a doctor, do not end your treatment after writing the prescription. For every case which is there, whether it is a diabetes case, whether it is a hypertension case, whether it is any other case, health education is most important. So as far as the treatment, anti-helminthic treatment is concerned, generally we have piperazine citrate for in case of ascariasis. We generally use piperazine citrate, or we use parental palmoate. Piperazine citrate 75 milligrams per kg body weight, maximum dose of 3.5 grams for 2 days. It basically paralyzes the paralyzes the worm, and the worm then gets excreted out. Um, so, as far as mebendazole and albendazole is concerned, mebendazole is given 100 milligrams BD for 3 days. Don't give it to children who are below 2 years. Levamisole, oral tablet, 2.5 milligrams per kg body weight, and this has been used in the past for mass treatment of ascariasis. At the present moment, the deworming program of the government of India uses albendazole. So we'll talk about that when we at the end of the program. Parental palm 10 milligrams per kg body weight. Mass treatment, the indications are prevalence of parasites and protein allergy malnutrition in the population. Mass treatment is helpful in reducing the worm load. The only way ascariasis will be eliminated is by sanitary improvement. So let's then jump to hookworm infestation. Hookworm infestation, you are well aware, is an intestinal parasite of humans. It includes two types, that's Ankylostoma duodenale and Necator americanus. You have studied it in detail in your microbiology and pathology classes. I will not go into the details as to differentiation between the two and all sorts of things which are there. This is not the scope in this lecture. Again, close to 1 billion infections which take place in the world, mainly in Asia, 70% of them in Asia. Annual death rates similar to ascariasis, 60 to 65,000 due to the hookworm anemia. Now, you're well aware that hookworm infestation results in anemia because you have blood loss which takes place. So if you see, if you'll just see this, the morbidity and mortality from hookworm infestation depend on the worm load. The worm load, which is calculated by the Chandler's index, is very helpful in determining how much is the problem. So less than 200 eggs, you say is not a significant infection. 200 to 250 eggs is a minor infection. 250 to 300 eggs is a moderate infection. And greater than 300 eggs, you say is a severe infection. So Ankylostoma duodenale and Necator americanus, you have adult females which are there in, as far as the Necator is concerned, the Necator is a slightly shorter worm which is there, 9 to 11 millimeters, while Ankylostoma is 10 to 13. In case of adults, adults are always smaller in worms, so you have 7 to 9 millimeters in Necator and 8 to 11 as far as Ankylostoma duodenale is concerned. The reservoir of infection, please remember this is in millimeters. We had ascariasis which was in centimeters. Ascariasis is a large worm, the largest nematode which we have over here, and here we have this which is just about a centimeter, maximum a centimeter in length. Reservoir of infection is man. I will not go into the details of the differences between Necator and Ankylostoma. Please read it up. Now you're aware as to how the life cycle takes place. The filarial worm which is there penetrates the skin, the web spaces of the leg when a person goes into the fields and the person is walking in the fields. The filarial worm which is there penetrates the skin and traverses into the skin, comes and then lodges later on into through a cycle which is there, comes and lodges in the intestinal tract where it gives the eggs, and the eggs which are there are excreted by man, and in the ground it forms into the rabbit form larvae, the filarial form larvae, and then it comes back. So it affects all age groups, especially if you're looking at children. Children are a high risk group. It affects more males than females because more males are there working in farms, so you'll end up with more males suffering from the disease. And the infection with hookworm can create serious health problems for newborns, children, pregnant women, and malnourished. Malnourished always. The malnourished are the ones who will have problems in all diseases. We are talking about even in COVID, we talk about the malnourished having problem. And malnourished is, in this particular case, malnourished we mean poor nourishment. But whereas in case of COVID, we have malnourished on both sides of the spectrum. It is said there's a I can we can call it a rumor or a hypothesis which says that those individuals who are overweight and who are obese are more likely to suffer from COVID problems than those who are normal weight. A lot of big study going on that. We will, I'm sure you all must have read up. If you don't, if not read up, please go into Google. Google is giving you a lot of material on that. So again, temperatures of 25 to 35 degrees, shady, sandy, loamy soil, and vegetation is growing. There is a place where the eggs and the larval forms can thrive. And our population, we have a large group of population in our country which does not wear shoes. Even in the fields, it doesn't wear shoes. So the chances of penetration of the filariform larvae is very high. Hookworm infestation occur mostly in the tropical and subtropical climates. Why? The reason is because they require humidity, they require temperature. Both these things present in tropical and subtropical climates. Not present in the temperate world. You have less amount of, though humidity may be present, but the temperatures are much lower. So the growth of these parasites is much less. Indiscriminate discomodification or defecation, which is the open air discomodification, and social factors like illiteracy, ignorance, low per capita income. We talked about this initially in my lecture. The larvae, as we said, it penetrates the skin, is a geohelminth. Walking on bare feet is the reason for this. Gardeners, also miners. Miners, you see, the big problem in mines is when you go down. I wish many of you will go down into the mine. There is no toilet. Where will the person go for his job? He has to go around, and the other miners will come and they will also go around in this place. The water will get contaminated with these larvae, which may this excellent. It is hot and it is humid. Best place for the larvae to proliferate. So the incubation period is in Ancalstroma is 2 to 9 months, and Necator americanus is much shorter, at 7 weeks. So what all can this form? You have with the migration of the larvae, you have bronchitis and bronchopneumonia, which takes place in the lungs, and the skin you may have dermatitis or creeping eruptions. And as far as the adult worms are concerned, in the intestines, they may cause hemorrhages and nutritional problems. So, as we said, the web spaces of the skin, you may have ground itch which can take place, or due to migration of the worms, an allergic response may form and you can have itch anywhere in the body. Respiratory problems during the migration, you have pneumonitis, cough, dyspnea, hemoptysis. And GI tract, you have anorexia, fever, diarrhea, abdominal discomfort, weight loss, nausea, vomiting, and rarely you may have spleen or liver involvement. So this is showing where all you can have the problems. Pneumonitis, hepatosplenomegaly, abdominal discomfort. We have covered all these things which are there. Main problem which we have is anemia. This is caused by blood loss at the site of the intestinal attachment of the adult worms. and this adult worm secrete an anticoagulant from their buccal cavity that results in blood loss. One ankylostoma duodenale is estimated to be responsible for the loss of 0.15 to 0.26 ml of blood per day, and one Necator americanus results in 0.03 ml per day. So, if you want to have an infection, please have a Necator one rather than ankylostoma. You lose more blood in ankylostoma infection. So, any hookworm infestation can result in iron deficiency anemia. Also remember, our country has got this problem of iron deficiency anemia present among a large amount of population, and that's the reason why when we talk about antenatal care, we find that approximately 70 to 80% of females who come in have got iron deficiency anemia, which may not be due to hookworm infestation, may be due to nutrition itself, but hookworm infestation adds on to this problem, and you can have more of anemia because of hookworm infestation. So malnutrition plus hookworm infestation will result in further malnutrition, further iron deficiency. Stool examination, macroscopic and microscopic, or you can study the duodenal contents. Really not required, but can be done if in the case of research work. Blood examination, basically one has to look at microcytic hyperchromic anemia which is there, and general examination of the stool will show you can find that there is blood in the stool and Charcot-Leyden crystals which are present. The microscopic examination of the stools, you have done this in microbiology. We just run through it. You collect a stool specimen, fix the specimen with 10% formalin, concentrate using the formalin ethyl acetate sedimentation technique, and then mount the specimen which is there. Direct wet mounting examination is to be done, and you can see a moderate to heavy infestation. The examination of the eggs cannot distinguish between Necator americanus and ankylostoma duodenale. For that, you require to see the larvae, and so you'll have to possibly rear the larvae and then see the what is the type of larvae which is present. See, this slide was made for possibly for non-medicals, so that's why they say light yellow color of skin. You will see pallor. You see pallor, and you know how to see pallor, which is seen in the mucous membranes or in the skin. If the anemia is very heavy, then you will have edema. So that's why we're talking about the puffy face or edema of the feet and ankle. So that is very severe anemia. Generally, when the anemia is below 6 grams, then we are looking at edema taking place. So these are the various things. I will not go into details about it. Diagnosis, so basically from you're looking at anemia, low hematocrit count, hemoglobin is decreased. You can look at serum ferritin levels, low transfusion saturation. Really, do we really require to do all these tests? Not really required, but you have all our great physicians who would like to do all these tests. They may also want to do an endoscopy. I don't know why. Not really required. You don't require an X-ray examination or a barium enema. These are all mentioned with just for the completion's sake, which are done by physicians or by gastroenterologists. Not really required. The only examination required is a stool examination, and that's all that's to be done. During the migration phase of the larva, you have wheezing and cough, which are there. So that you'll have to manage possibly by beta agonists, which are there. Early infection, round itch. You can have some. You can do some treatment, some thing to allay that itch which is there. You can give antihistaminics, and also give thiamidazole. Can be given during an attack of the migrating larvae. Otherwise, you give anti-helminthic therapy. We will talk about it a little later. For an established infection, you give anti-helminthic therapy, and for the iron deficiency, you need to give. So, what do you give? Anti-helminthic therapy, which you give, is 2 mebendazole and albendazole. There is a mention of bifenthrin hydroxynaphthate and tetra TCE, which is effective against both species. It is, we generally do not tend to give these things. We generally give mebendazole or albendazole, which gives sufficient amount of cure. Mebendazole, as we mentioned earlier in ascariasis, is also 100 milligrams 2 times a day for 3 days. Second course to be given after 3 to 4 weeks. Pediatric course dose below 2 years not to be given. Above 2 years, give the same dose as adults. Albendazole, you give 400 milligrams per day at night, and for 3 days you can give, and repeat it after 3 weeks. For below 2 years, you give 200 milligrams and repeat it after 3 weeks. This is what is to be given. Pyrantel palmate, you can also give pyrantel palmate, but generally we are giving mebendazole and albendazole. Iron supplements are to be given, and these iron supplements can be given as syrups or tablets based on the age of the individual. Give iron-rich foods. What is that? What is iron-rich foods? Give green leafy vegetables. You can give various other iron-rich foods which are there. Give jaggery, or you have so these are the various types of tablets which we have, or salts which we have, which give iron: ferrous fumarate, gluconate, glycine sulfate, succinate sulfate, and dried sulfate. These are the various things which are available, and the amount of elemental iron which is present in them is mentioned in the slide. That is, what we normally are giving is ferrous sulfate, which gives you from 200 milligrams tablet, you get a 60 milligram of elemental iron. Please remember this. This is asked in the exam very frequently. 200 milligram tablet giving 60 milligram of elemental iron. Okay, so what we are really looking at is doing personal hygiene, sanitation, health education, same sanitary disposal of feces, wearing footwear, similar to the ascariasis. So really I don't need to repeat it. These are the same things: sanitary disposal of feces, treatment of infected persons, wearing of shoes, health education, and improved nutrition. Well, the Rockefeller Foundation began its campaign to eradicate hookworms in 1907 and yellow fever in 1915. Both these campaigns failed. The hookworm campaign, because mass treatment did not prevent rapid reinfection. Basically, what was required was sanitation. So in the Philippines, the prevalence rate was decreased from 33% to 1% by mass treatment. So 1907, when they tried it out, they had only one thing: mass treatment, but possibly the mass treatment campaign was not effective enough because of you not doing sanitary things together. So when you do both the things together, like what was done in Philippines, you do sanitation, health education, good water supply, as well as do a mass treatment, then you can land up with decreasing. So did we do it? Yes, we have also done a mass deworming campaign. We'll talk about it. So we have two things which we did. One was the National Iron Plus initiative, and second was the mass deworming campaign. So we'll talk about both these things today. The National Iron Plus initiative is an attempt to look at iron deficiency in anemia comprehensively across all life stages, including adolescents, women in reproductive age group, and who are not pregnant. See, India has been carrying out this supplementation of iron and folic acid for pregnant mothers since a very long time. But we never looked at the fact that if you have girls who are having decreased amount of iron with them, if they are anemic, they are going to become anemic mothers. So let's look at the girls first. Let's look at the adolescents first. And once you look at the adolescents and bring up their levels of hemoglobin, automatically you will find that you have women who are non-anemic. So these are the tablets and the liquids which are being used. This is a chart which is very important. Vision 2025, anemia free, reduction of anemia by 50%. The total beneficiaries are 45 crore. And this we use the Village Health Nutrition Day and Rashtriya Bal Swasthya Karikram. These are two programs which are there. Village Health Nutrition Day, please remember this, Village Health Nutrition Day and Rashtriya Bal Swasthya Karikram. These are things which are done. The anemia status which is there, I mean, this and the next slide, actually this slide is only shows the figures that there is anemia, whether you look at adolescent girls or whether so when you're looking at children 6 months to 6 years which is there, you've got 59% of them are anemic, and what we are planning for is to bring it down to 29. We don't say that there will be nobody, we want to bring it down to 20. I mean we are expecting that it will be 29%, but with our interventions possibly it will be brought down even further. So pregnant women at the present moment, this slide says 50% in 2015-16 is not so, it's about 70 to 80%. We want to bring it down to 25%. Lactating mothers about 50%, again to be brought down to 25%. So what are we going to do? The interventions which are there is we are going to do iron and folic acid supplementation. We are going to do communication and health education for consumption of iron-rich foods and use of iron, folic acid and albendazole compliance. Use fortified foods and especially we distribute these in public health facilities, and test and treat nutritional anemia in school adults. The slide has gone haywire because of the presentation, but basically it is test and treat nutritional anemia in schools, school going adolescents 10 to 19 years, and also in pregnant women. So these are the basic 4 things which we are going to do. And this slide, this is rather, I was saying that's the most important, this is the most important slide that we have, that is folic acid supplementation program. Now this folic acid supplementation program, we start off, so folic acid, iron and folic acid supplementation right at childhood from 6 months to 5 years. We give 1 ml of iron folic acid syrup which contains 20 milligrams of elemental iron, 100 micrograms of folic acid, and this is given bi-weekly throughout the age group 6 months to 5 years. And we also give deworming for children who are 1 year and above. Who gives this? This is given by the ASHA, and the ASHA gives the IFA bottles handed over to the mother, and also during the Village Health Nutrition Day sessions which are there. So once it is child is above 5 years, 5 to 10 years, the child takes tablets. The tablet contains 45 milligram elemental iron and 400 micrograms of folic acid. This is given weekly throughout the period 5 to 10 years, and again you do deworming biannually 2 times a year. So in this is what, where is this done? Who does this? This is done by school, in the school by teachers. Then 10 to 19 years, you have 100 milligrams of elemental iron and 500 micrograms of folic acid. Weekly throughout the period 10 to 19 years, again a biannual deworming which is to be done, again by school teachers, and those who are not going to school, that is by the Anganwadi workers. Pregnant and lactating women, 100 milligrams of elemental iron, 500 micrograms of folic acid, and 1 tablet daily for 180 days. This is one mistake which we keep making. We keep saying that it is for the complete period. It is not for the complete period. Iron tablets are generally not to be given in the first trimester. The reason is that it causes constipation, which the mother is already having. So that's the reason why we try to avoid in the first and the final trimester. We try to avoid it, but we start giving it at the first trimester, but the first few months we try and avoid. It depends upon how much is the what is the whether the lady is having more of anemia or not. 14, you start at 14 to 16 weeks of gestation and continue it for 180 days. Okay, given by A&M and the ASHA worker. So this is a slide which shows you that we are covering the complete spectrum of children, adolescents, pregnant and lactating women, and women in the reproductive age group. The complete spectrum. I have already covered all this. Whatever is there in this slide has been covered in the previous slide. So these two slides, if in your exam, if you are able to reproduce this particular slide, would be very good, because this will give an idea that you've understood this particular topic very well. Now, the second thing is deworming. Now, deworming, there are 241 million children at risk of intestinal worms, and basically due to poor sanitation, hygiene, soil transmitted we have already talked about all this. Major cause of anemia. Almost 7 in 10 children, that's 70% of the population in the age group 6 to 59 months, are anemic. So the National Deworming Day was launched in February 2015, and a single fixed day approach to treating intestinal worms in all children 1 to 19 years, and held on 10th of February and 10th of August every year. 10th of February and 10th of August every year. Remember these days, they are very important days, National Deworming Days, or as I mentioned, National Village Health Days. Okay. It aims to create mass awareness about the most effective and low cost treatment which is there, that is albendazole tablet. So what was the objective? To deworm all preschool children 1 to 19 years through the platform of schools, Anganwadi centers, and look after their health, nutrition, and education and quality of life. What do? We give at 1 to 2 years, you give half a tablet of albendazole, 400 milligrams tablet, while 2 to 19 years, you give the full tablet. So basically, you're giving 200 milligrams for those children for 1 to 2 years, at 400 milligrams to children who are 2 to 19 years. If the syrup is supplied, 5 ml is to be given for the 1 to 2 years on a biannual basis, and 10 ml for 2 to 5 years, given by the teacher or the Anganwadi worker. Should ensure that there is good water which is there, and if the children cannot have it, you can crush it and give it, break it and give it. Gently, for those people, you have syrups available. That's all. Thank God that it finished, because my throat is going dry. I need some water to have now. So all the best. Please read up. You have not been coming for classes. Please read up and keep yourself updated. We require to ensure that we have had one internal assessment. We'll be having another internal assessment when you come back, and that internal assessment will possibly be in the college. I don't know. I've been told that from 1st October you all are coming to college, so we will hope that you come, and we'll be able to interact more. Please do remember, COVID may come and go, but your exams will be there. The Medical Council of India has very categorically said no person is going to be promoted in the medicine field without an exam. So you will have an exam. So please ensure that you keep reading and keep yourself abreast. Thank you.